Why does healthcare cost so much? Some of the things that drive healthcare spending in the United States include our fractured healthcare delivery system and the pace of technological change and the kind of new technologies that we're able to use in our healthcare system, because we have so many providers and hospitals and other ways to get healthcare, and we have so many different organizations paying for healthcare. You get a lot of lack of coordination and different kind of behaviors that increase costs. But one of the other things that really drives healthcare spending in the United States is how healthy Americans are, and the high degree of chronic illness that we have, the increasing rates of obesity, and other factors that drive our need for healthcare services. What is affordable healthcare? Well, I think the best way to understand what is affordable healthcare is to look at a family and sort of what their income and resources are and how much they're spending overall for healthcare. So, between the premiums that they pay, or the share of the premiums that they pay if their employers pay part of it, and how much they pay for cost sharing, the kind of deductibles and co-payments that they have to pay, and then what they just pay out of pocket for uncovered services, and how that relates to their income. One of the kind of thresholds that a lot of people use is if families are paying more than 10% of their income for health care, that's really unaffordable. And I think that's one of the best ways to look at whether health care is affordable or not. And what steps can we take to make healthcare more affordable? I think the major ways of improving value in healthcare and making healthcare more affordable are first to use the market power of large groups to pool people into purchasing pools and give everybody greater leverage against the insurance companies in finding good coverage at a good price. Like, another important thing is to provide the kind of subsidies that people need in order to provide insurance, so that related to income, that they're not paying more than is affordable for their total spending in healthcare. And then another thing is to work on improving the value of what we get for our healthcare dollar. So understanding what kinds of drugs and treatments and devices work best, and using health information technology not only to reduce administrative costs, which is certainly one thing that it will do, but to improve quality of care, so that physicians across all the physicians that you see understand what drugs you're getting, what your condition is, what kind of treatments you've had, so that within a hospital that information is shared and labs are shared and all of that kind of information as well, so that your care is best coordinated. And then I think also improving how we provide care and coordinate care for people with chronic illness, so that instead of the patient being so responsible for ensuring that communication between all of their providers, so that we have a more cohesive centered on the patient, but with all providers working together as well to best coordinate care for people with diseases like asthma or diabetes or depression or any of the other chronic conditions that really affect people's lives.